Module 1, Introduction. Welcome to the Introduction module of the course on the role of parliaments and parliamentarians in strengthening health security preparedness. Let's have a look at the objectives for this course. At the end of this course, you will describe the concepts of health emergency preparedness and health security and discuss the importance of these concepts and the International Health Regulations 2005. Identify global and domestic opportunities for parliaments and parliamentarians to help achieve health emergency preparedness and health security. Explain the various global and domestic functions of parliaments and parliamentarians to help achieve health emergency preparedness and health security. Recognise the unique role of parliaments and parliamentarians in advocating for and achieving health emergency preparedness and health security. Explain practical suggestions, actionable recommendations, and further resources. Parliamentarians can leverage their various roles and positions to advocate and lead, and to bring about better emergency preparedness and health security. The parliamentary functions of lawmaking, oversight, accountability, and budgetary approval, together with the individual opportunities that parliamentarians have as representatives and community leaders, should be put to use so that health emergency preparedness becomes a priority and the devastating impact of COVID-19 and other health emergencies is never again repeated. Parliamentarians act collectively as a parliament, but may also contribute individually as parliamentarians to the activities of their parliaments and their constituencies. Options for action to support health emergency preparedness and health security are as multifarious as the types of positions that parliamentarians can hold. The commonality is that all parliamentarians may serve their own communities and constituencies powerfully as influencers, leaders and advocates by supporting and protecting human health and economic security. As lawmakers, parliamentarians can directly contribute to legal preparedness for health emergencies by helping to develop and then passing appropriate legislation. Through their accountability and oversight activities, parliaments and parliamentarians can hold governments to account for their commitments to plan, implement and fund health emergency preparedness and to implement the International Health Regulations 2005. As representatives, parliamentarians may contribute in their own constituencies through formal or informal advocacy and communication to promote public trust. Not all of these actions will suit the needs of every country, but they provide ideas and examples that may be worthy of further consideration. All of the suggested actions have been drawn from the experience of parliaments and parliamentarians. Health security preparedness. What they are and what is necessary to achieve them. Finding out more. Opportunities for parliaments. International Health Regulations 2005. What they are and what are the obligations of states parties. Finding out more. Opportunities for parliament. Parliamentary functions, oversight and accountability. How the oversight function can be leveraged to achieve health emergency preparedness. Budgeting and oversight. Finding out more. Opportunities for parliament. Parliamentary functions, lawmaking. How the lawmaking function can be leveraged to achieve health emergency preparedness. Finding out more. Opportunities for parliament. Parliamentarians as representatives and leaders. How parliamentarians as representatives and leaders can contribute to health emergency preparedness nationally and within their constituencies. Finding out more. Opportunities for parliamentarians. Parliamentary opportunities for international cooperation and activity in multilateral organisations and other international activity. How parliaments can operate within the international arena to support health emergency preparedness globally and domestically. Finding out more. Opportunities for parliament. Maintaining action on health system priorities. how parliaments can ensure that the focus remains on supporting the health system and its priorities, finding out more, opportunities for parliament. Let's recap what we have learned. Parliamentarians can leverage their various roles and positions to advocate and lead and to bring about better health emergency preparedness and health security. Parliamentarians act collectively as a parliament, but may also contribute individually as parliamentarians to the activities of their parliaments and their constituencies. As lawmakers, parliamentarians can directly contribute to legal preparedness for health emergencies by helping to develop and then passing appropriate legislation. The suggested actions may or may not suit the needs of every country, but they provide ideas and examples that may be worthy of further consideration. The actions have been drawn from the experience of parliaments and parliamentarians. Here is a question you can ponder over. How can parliamentarians leverage their various roles and positions to enhance preparedness for health emergency and health security?